Hey guys, bit of a random video, but one of the things that you have to do post-surgery for 5 days is to give yourself an injection of heparin, which comes in these kind of pre-packaged little jobbies here. You can inject them into your thigh or into the bottom of your stomach. And I kind of thought, well, my stomach has enough scars on it, so I'm going to go for the thigh. Now, it's not that difficult to do. The main problem, if I show you my leg, is if you don't do it very well or don't do it very quickly, you'll end up, I don't know if you can see that fella, with a little bit of a bruise, kind of like what's called a hematoma under the skin. And that's basically because I probably went a bit too deep with it. I didn't pinch the skin enough, so it's kind of caused bleeding under the skin. Okay, because it is a kind of blood thinning agent. Now when you do it properly, as I've kind of been doing it better the past couple of days, you can see this little fella here, that's kind of the only mark, and that's kind of the hole in my thigh there, so it's pretty small. The way that you do the injections, I'm sure if you're like diabetic, it's probably quite easy for you. So this is my thigh, this is my knee. You kind of pinch a kind of hard chunk of your skin, and then you take the needle out, you sterilise, you're given little steri swabs, sterilise the bit of skin, you take the needle out, it's already pre-filled, okay, and the needle length is probably about 1 centimetre, okay, so it's not massively long. It's not supposed to go into your muscle, just kind of the subcutaneous fat, which that is a bit medical, but just kind of the chunk of skin here. That's why you would lift it, not just put it straight in, because you don't want it in your muscle. It stings a little bit. The biggest problem I have is that, like, I can't even wax my own legs, not because it's particularly painful, just because it's really hard kind of doing it to yourself. So it does take me a few minutes. I kind of put the needle in far too slowly. I could probably do it a bit faster, and I do put the injection, like the actual fluid, in quite slowly as well. But I kind of think, well, better that than, you know, maybe not doing it right or whatever. So this is day 4 of these fellas that I'm doing myself, so it's kind of, yeah, it's getting easier. So that's just a little bit about the anticoagulant medication. Cheerio! It has been, gosh, how long is it now? Is it 2 weeks since my surgery? Yeah, wow, it is, yeah, it's it's 2 weeks today actually, so 14 days since my gastric band surgery in Brussels. The last video I posted was literally the day after surgery, where I wasn't feeling super amazing, but not terrible. I felt a lot worse. And I haven't really posted since because I've had kind of camera issues, and I've generally been quite busy and up to my eyeballs. So I thought, if I have a few minutes now, I may as well catch up and tell you what's been going down. It's all been quite interesting. I thought I'd talk a bit about what the surgery was actually like. It's quite interesting. Kind of one of these people who's kind of morbidly fascinated with all things surgical, because it can be quite interesting, I think, you know, the things that happen. So on the surgery day, on the morning of surgery, which was 2 weeks ago today, I went to the hospital, the AZ Portinals, I can't pronounce it properly. It's a brilliant hospital, so it kind of makes you think, wow, the NHS isn't so great. It's a semi-private hospital, massive, so that means it's kind of state funded, but I suppose certain surgeries wouldn't be, like obviously the gastric band with Dr. Chris. So I went to the hospital at 7. I was in the Lodge Hotel, essentially directly across the road, which was brilliant because I just had to walk across. The hotel was lovely, but I'll talk more about that later. Went across to the hospital. you kind of have to go through an older part, and you end up in the newer part, the kind of new clinic part, which is still huge. You go to a desk, you check in, you show your passport, they confirm all your details, with loads of other patients as well, like nothing specifically to do with Dr. Chris. And that second they gave me basically a wrist tag with my name, barcode saying all my details on it presumably, and things like that. So that's quite reassuring that, you know, they're really on the ball, really organised. So I got there at 7. That was all done and dusted by about 7:15. Got told where to go, went up to the ward I was going to be staying on, and sorry I keep moving, I'm just a bit uncomfortable. So by about 10 to 8 I had the bed I was going to be in the hospital done. I'd been introduced to the nurses, I'd been given my dressing gown, like the surgical gown for later on that day. I'd measured up for surgical stockings, and I was ready to go. So it was just impeccably quick, bizarrely so. It was just such a whirlwind. Really efficient staff, really pleasant. Generally very good English as well. When I was staying there, there was another lady who was also getting gastric banding with Dr. Chris, who you know, booked through Bridget at Europe Surgery. So she was staying in the Lodge Hotel. We'd met the night before when we'd gone to meet Bart to talk through some of the issues about surgery, which was very comforting. He talked in a lot of detail. And she was a right good laugh. So we ended up in basically a twin room together. The rooms in the hospitals are just impeccable. You really never see anything so clean. Each kind of bed has its own area, its own little storage area. In the bathroom, your bed corresponds to a specific sink, so you can't like wash in someone else's sink. So I suppose it's to do with infection and things like that. So yeah, super clean. Got settled. Nurses came around, did blood pressure checks, did an ECG, an echocardiogram, so that's where they trace your heart. That was all really efficient, done really quickly. And then we were set up with our IV. So we were kind of, you know, the needle was put in, the tube was put in and left there, nothing hooked up to it, just at the time. We were all kind of ready to rock and roll. At about 10, I think it was, Bart came round and said, you know, are we okay? Do we understand everything that's going to happen? Are you worried about anything? Which is when I kind of reiterated the fear I still have, of general anaesthetic, which he's kind of, you know, smiling at, because, you know, it's so comparatively safe these days, and you're under for such a short amount of time that really there's nothing really to worry about. But I suppose I am a bit of a head case when it comes to things like that. It really stresses me out. So he very kindly got one of the nurses to give me some pre-meds, which I presume was like a Valium, which was one of those fast acting melty things on the tongue, which was very pleasant altogether. So I was like, By about 10:30, I'm like, oh yeah, I'm chilled out now, cool. All was good. Boyfriend was there with me in the room with this other lady and her daughter, and we were just having a right good old laugh. Actually, it was good fun. It was about 11ish when Dr. Chris came around. He sat with us for a good half hour anyway, just talking through the surgery from a kind of surgical point of view. You know, what can go wrong, which you have to be prepared for in any surgery. But he also talked about his experiences. Now, he's a massively experienced surgeon. He said when he got to 5,000 surgeries, he stopped counting. So he reckons he's in the 6,500 gastric band surgeries. So, you know, he's been doing it for 16, 17 years. And and you know, he obviously keeps up to date knowledge and is kind of using the most state-of-the-art bands and all that kind of stuff. And he said, you know, the newer bands that they've been using for a few years now tend not to slip because you can stitch them in place. They're, you know, they don't aggravate the stomach so much. They tend not to move as much. They're more flexible. So all the kind of those kind of erosion and slippage potentials are kind of essentially wiped away. Obviously, there is still some kind of risk, but you know, he said it doesn't happen really at all. He talked about, you know, the risk of infection, very minimal. Obviously, the clinic we were in, the part of the hospital we were in, is, you know, for elective surgery, so there was nobody with illnesses there, so there's nothing really kind of, you know, that you could pass on to other people. Everything was very modern, state-of-the-art, so really the risk of infection, I would suggest, is quite minimal, but obviously it's still there, so you have to be aware of it. It's quite it's quite funny. Dr. Chris talks really, really fast, which is fine for me, being Irish, because, you know, we talk really, really quickly, so I was getting it all. The lady was with me was like, what was he talking about when he was talking about this? What was he saying when he was doing that? He just talks really quickly, so obviously if there's something you don't get, you don't understand, you need to just, you know, slow him down. So that was all really good, very comforting. He knew what he was talking about, was able to answer questions that I had about, you know, about the swelling afterwards, how long would it take to eat certain types of foods. We had good conversation about the kinds of foods that you shouldn't be eating straight after surgery, all that kind of stuff. So that was quite good. He poodled off to theatre to get ready. I was told I was going down first. So at about 12:10, said goodbye to my boyfriend, hooked up to a drip and brought down to the preparation room. Basically there's like a massive room in the centre of all these theatres that people, basically like a holding room waiting for you to go in for surgery. A nurse came along and hooked me up to a second drip, which she told me was antibiotics, which is just like a preventative measure. So they, you know, make sure, you know, if there's any chance of infection, you've taken antibiotics, it's going to get rid of it anyway. So that was quite good. Then I was wheeled into theatre and Bart was there, and he was, you know, laughing and joking and stuff, and I was kind of saying I'm absolutely cacking myself now because I really didn't like the idea of general anaesthetic, like really, so I was getting quite anxious about it. But he was very comforting. He was like, oh, don't worry, you're just going to have a nice little sleep, you won't even remember anything, you'll be fine, don't worry. A nurse came along and hooked me up to another ECG machine, which is, you know, really good. You know that they're monitoring you. I had a blood pressure cuff on. I had a heart rate monitor, like just hooked up to everything to make sure, you know, everything's good. The operating table's a bit weird. If like I've been on one before when I've had surgery before, but it's like quite thin, and it kind of has arms that they hook on, so you lie with your kind of arms out in a bit of a crucifixion pose. And they kind of loosely secure your arms to this table. But a bit of a weird thing if you're not used to it. You're kind of like, what the hell's going on here? So they did that. Anesthesiologist came along and explained to me what they're going to do. The anaesthetic was going to go straight into the IV drip, and you know, you'll never make it anywhere near 10. You'll be gone completely out. So I was like, okay, right, I'm ready now, let's just do it. So they injected the anaesthetic, and I got to 2, I think, like 1, 2, and then I don't remember anything. But you can feel, because I haven't had general anaesthetic since I was a kid, so I don't really remember what it was like. It's not a pleasant feeling. Some people, just things like that don't faze them, and that's brilliant. But, you know, I'm really quite paranoid about kind of, you know, what happens, you know, you're not in control of your body, all that kind of stuff. And you can kind of feel it going through your arm first, and it just kind of makes you feel really drowsy for a second, and then you can't move for like literally the splits of a second, and then you're gone. So I remember saying, I don't like it. I think I got those words out. That's how long it took me to go unconscious. I don't like it. And I heard Bart laugh, which is nice. and then I was gone out like a light. And the next thing I remember, I was waking up in recovery, which was quite a big room with lots of cubicles, quite low lighting. Obviously, they don't want it too bright. It would be quite jarring. So quite low lighting. There was loads of nurses. They were moving me from the operating bed to like a regular bed, and obviously I'm hardly, you know, I'm not forced down. So I remember the nurses saying, you have to help us, you have to help us move. They were trying to, like, I don't know how I was out of it. I don't know how long they were trying to get me onto this onto the hospital bed. I don't know. But I remember saying, I'm trying to move, I can't move. I was being all really whingy and stuff. But they got me onto this bed anyway. And my mouth was like just the driest thing. It was so uncomfortably dry. Because they had a breathing tube down. So you're intubated. So just to keep an eye on your lungs, obviously. So my mouth was just, oh my God, pure Sahara. It was awful. And I was quite in, I wouldn't say extreme pain, it wasn't that painful, but where the port is, because that's the biggest incision, and it's kind of, you've stitches onto your muscle that's holding the port on, that was quite uncomfortable, to the point where it wasn't just pain when I moved, I could feel the ache in it while I was lying there. So I got like the attention of a nurse, and I said, look, I'm really uncomfortable. Came along, get me some pain meds. It was fine. I remember looking at the clock, and it was 20 to 3. So I don't really know what happened in those hours. Obviously I was brought down. I reckon I went into surgery probably just after 1ish, I think. Obviously you have a bit of prep there, 25 minutes of the surgery, 30 minutes, a couple of stitches in, and then out to recovery. So it was really quick when you think about it. From leaving the leaving my ward at whatever it was, 12:30ish, something like that, I was back up on it by 2:45. Got back onto the ward. Boyfriend was there. Nice to see him. He was a bit relieved, I think, that all was okay. Got back onto the ward. Nurses came round, took my blood pressure again, took some bloods again, gave me some, it was actually just paracetamol through the IV, but it took the edge off, let's put it that way. We weren't allowed to drink anything, but we were given, I was given, you know, one of those sponge things that you dip in water, because I was really struggling to even talk. My mouth is that dry. And as you can probably guess, I quite like talking. So all that was good. We had a nice little relaxing time of it for a bit. Watched a bit of telly. The rooms were awesome because you had like your own flat screen TV, like a little one. And you could control it with, like, obviously a remote control thing. But you could listen to the sound through the remote control, obviously to not disturb the person beside you, or you could put it onto, you know, loudspeaker. You could control all the lights in the room with it, you know, all very swanky. The beds are good, lots of different angles of the beds, all that kind of good stuff. So hooked up to a drip, painkillers, saline as well. And that was pretty much it until the next morning. All through the night, we had nurses constantly in and out, which was kind of annoying actually. You just about get comfortable and then the nurse is coming to check up on you, but it's a good thing. So we had like pain meds every 4 hours. They were like clockwork. And then every 2 hours they came around, did your blood pressure. They took like a small amount of blood. And what else did they do? Blood pressure, small amount of blood, temperature, making sure you're not like overheating, getting an infection, stuff like that. So all that was, you know, super professional. Really friendly. The next morning, nurses came, did last minute different checks on things. All that was good. We had to go down to X-ray to have an X-ray of the band, where you had to do like a barium swallow. That was probably the weirdest bit. It just felt like so like futuristic. It wasn't like a regular X-ray machine. You have to like stand on this little platform, and they kind of line up the X-ray to this area, and then it tilts you in different angles, and all the while you have to drink this barium, which shows up on the X-ray. It doesn't taste very nice. Not the worst taste in the world, but not very pleasant. And as I found out about 2 days later, thank God 2 days later, because I was home, it gives you a bit of a funny tummy. Now, some people it doesn't bother at all. Mine wasn't that bad, but I did kind of have loose motions, let's put it that way. But thankfully, not on my flight home the next day, because that would have been awful. So that bit was a little bit grim, just because it didn't taste very nice. It wasn't very comfortable, but necessary. And that was all good. You know, you have to do it. Make sure the band's in place. Make sure that there's liquid getting through and all that kind of good stuff. So I was really pleased with that. Back up onto the ward. We had, what happened then? Chris came round to talk to us a bit more. You know, what we can expect the next few days. He did say, you're probably going to get a funny tummy from the barium. It's a necessary evil. It's not the nicest thing, but it has to be done. So I thought, well, that's fair enough. He said about, you know, we got these printouts of what we should try to consume, things to really stay away from, things like don't ever eat bananas ever again, because they form a little ball in your stomach, or doughy bread. The first 2 weeks is liquids, pretty, you know, thin liquids, kind of, you know, the first foods that you would maybe give a baby, so like pureed fruit and that kind of things, and cup of soups, no lumps in. And we got these really detailed printouts about, you know, what we should and shouldn't do. We got contact details for Chris. We got told about the incisions that he made, really, really small. In another video when it's daytime, because it's nighttime now, I'll show you my incisions. They're really tiny. There's basically 1, 2, 3. There's 3 ones that are about like literally that big, so about a ½ centimetre. One on the right hand side, which was for one of the utensils, I don't know. One nearer my belly button, but not really that close to my belly button. One about 2 inches above it. So the 3 of them are really small. Then the 2 other ones, there's one where the port goes in, and that was a bit of a weird one actually, because you would have thought that would have been a bigger incision, but it was a weird incision. It was just that the way that it's cut was a bit strange. So there's that one, and then there's one on the left hand side, which I think might have been where my drain was. Oh, I've got to say, yeah, a drain was put in as well during surgery. So that's to make sure that, you know, if there's any fluid build up, it would come out. And they took record of that every 2 hours as well, to make sure there wasn't like tons of fluid coming out of us. I think in total about 20 mils, which is just over a tablespoon of fluid came out. So it's like nothing. And that's the kind of, you know, he talked about decisions. All the stitches used were soluble. He said, you know, there is bits of stitches poking out, kind of the tail ends of soluble stitches, where the inside obviously is stitched, you know, with the muscle maybe. And then he left the tails out, and he said, you know, when you change the dressings, just snip those close to the skin. They do you no harm. They'll drop off eventually, but, you know, if you don't like the look of them, basically cut them off. And then there was one non-soluble stitch in the port side, which is like dark blue. And he said it's just one stitch. More often than not, they just drop out themselves. But after 10 days, if it's still firmly in place, you might need to go get it removed. Now, he said, you know, you can go to your own nurse in your GP surgery, because you've gotten the surgery done in Europe. They're not like as funny about, you know, oh, well, you've gotten this surgery abroad and it's one stitch. Yeah, it's not the be all and end all. So usually, you know, the nurses, the NHS are fine about it. And realistically, they should be more than fine about it, because we've saved them a hell of a lot of money getting this surgery done in a different country, paying for ourselves. But also the long-term effects, you know, when I lose all this weight, my health is going to be so much better, and I'm not going to have to rely on the NHS, you know, hopefully, thanks be to God, that, you know, not develop diabetes, heart disease, all the kind of weight-related things that, you know, I've not been able to deal with myself, that I could develop in the future, are probably not going to happen now, because of, you know, the weight losses that is going to be occurring. So really, we saved them in the long run a bag of cash. But anyway, that's politics for you. So he said, you know, more than likely they'll be fine with taking that stitch out. And even if they're not, you can go to, like, you know, like a Bupa hospital or Aviva, what are they called? Clinics, can't even remember. Nuffield or whatever they are. I think it's like 40, 50 quid to get a nurse to see you or something. So I was like, right, that's fine. And then he said, you know, obviously, if there's anything wrong, you need to contact us. If you're worried about anything, just phone one of us. We had, I've cards for Bart and Frederick, and, you know, email address, phone number for Chris. Basically, anything that I was worried about, they're like, just let us know. We want to put your mind at ease. The only thing he said, if you're getting a high temperature and it's not going down, if the area around the incisions feels too hot, you need to go to your doctor, because, you know, that could be a sign of infection, and that needs to be dealt with kind of more quickly. He said if your stomach starts to swell, or, you know, it's really, really painful to the touch, not just because it was painful in terms of it felt bruised. He said if it feels like really, really tender, you know, he said it's never happened in all my years, but there could be something wrong inside, inflammation or whatever, and you need to go to hospital, because that is, like, serious. That's like fluid build-up. But he said it's never happened. It's not going to happen, but just in case, you know, it's good that you're informed of these things. So that was all good. So met with Chris. Thank you, thank you, thank you. Here's all your printouts. Here's all your information. Really happy with that. And then he said, well, you're going to have something to eat and something to drink. And then, you know, once the nurses are done with taking all your bits and bobs out, you can head off home to the hotel. So I thought, okay, that's brilliant. We were given some food, which was we were given a drink first, which was so weird, because bearing in mind I hadn't drank anything in, gosh, like a day and a half, nothing. And I was fantasizing about really cold water, and I was like, oh my God, it's going to be so immense. And then they brought us like mineral water, still mineral water. And I took a mouthful of it, and I was like, actually, I don't really want this. But it was still nice to have it in our mouth, you know, it was just like really refreshing. And then they brought us some food. They gave us this vegetable broth, like a really thin soup, which was alright. It was a bit herby, but not in a good way. But, you know, it was fine. No worse than any kind of cruddy cup of soup you're going to get anywhere. So they gave us that. They gave us Dutch biscuits, and then you may have seen them in like Aldi or Lidl. They're kind of quite Germanic. They're like almost like crisp bread, like mega toasted bread, so it's dry as anything, really hard, but when you like kind of crunch it, it just goes into a powder. So when you chew them, they like turn into a paste, basically a really thin paste. So they gave us 3 of those. They were quite big. They were like about that big. Barely any calories in them, basically air, but they gave us 3 of those, and some like low-fat butter and sugar-free jam. And I was thinking, wow, like this is like actual food. I was really worried about this. I managed maybe 3 tablespoons of the soup, and I would say half of one of the Dutch biscuits with some jam on, and it was the weirdest sensation. I'm used to it now. You don't even notice it now, because it's been a couple of weeks. But you could feel it going into your, like, your pouch, the top half of your tummy. You're like, okay, that's gone down, thank you. And then you can kind of feel it filtering through the band, which is getting less and less, actually. I think that's just because obviously it was swollen, it felt really restricted. And the first few days, like even when I drank something, it would kind of like almost like suck its way through into the bigger part of my stomach. You know, like if you overfill a sink and then like whip the plug out, it kind of like goes down like in a tunnel and kind of sucks out through the bottom. That's what I felt like. It was so weird. I'm like, oh my god. And it was making a noise as well. It was really odd. So we had that to eat, and that was fine. I just felt like, oh my god, I can't believe I've eaten that. That's so weird. But I thought, being a bit of a sensible person, I thought, well, I'll wrap the rest of that up and I'll take it home, which I did. I put it in my bag. I thought, that's grand. I can eat some of them Dutch biscuits later. Nurses came around, really, really nice nurses. Some of them were really funny. One of the ladies was like, here's some water, drink it like it's the most expensive champagne, only sip it. I just think Belgian people are really dramatic. So she was really funny. It was really, really nice. Nurses came around, took her, you know, IV out. That was fine. Gave us another heparin injection, which you have to do for 5 days afterwards, which I have a separate video about the heparin. Yeah, so gave us a heparin injection in the thigh. Not pleasant, not awful. It is what it is. And then they had to take the drains out. Now, I was really worried about them taking the drain out, because I had a friend who had a tummy tuck years ago, and she said getting the drains out was like the worst part of the whole thing, because I think hers are stitched in though, but ours weren't stitched in because they're only in for like not even like a full 24 hours. So the drain was in the left hand side. Now what I thought was that it was inside your stomach about that much, like maybe even that, like maybe 3 inches at most. There was 3 inches of tubing inside your stomach. So what I was preparing myself for was pain, like discomfort of like pulling something through your skin. That's not what I felt. It was the weirdest sensation I've ever felt in my whole life. What felt like about 3 feet of tubing was pulled out of my stomach. No pain whatsoever. The nurses were lovely. I had a male nurse, and he's like, you know, it's not going to hurt, it's just going to feel weird. What I need you to do is like breathe in, breathe out, then breathe in again, and then breathe out really hard, and I'll pull it out at the same time so you won't even notice it. Well, it felt like an alien bursting out of the side of my stomach. I could feel the tubing. This is too much detail. Not painful at all, I promise you, not painful. I could feel the tubing kind of like snaking around inside my tummy, and it was just nauseating. It was just the weirdest sensation, not painful, but just made me feel a bit pukey because it was so weird. And I was laughing after it. You know, everybody was kind of laughing because I made such a weird noise. I was just like, ooh, it's gross. It was just horrid, but kind of funny afterwards. Felt so much more comfortable when all the stuff was out. They changed their dressings, popped new ones on. Literally just little, they're called opsite dressings. I've used them before. They're like about that big on each one. We were sent on our merry way with our prescription bags, which had, you know, basically the higher dose paracetamol on, soluble ones in. They gave us stuff for indigestion, stuff for cleaning the wounds, or and the heparin injections. They gave this stuff for cleaning, was to sterilise the area as well before you do your own heparin injections. So a little packed up my bag, off I went, back in the hotel by about 1:30. And I just thought, wow, that's absolutely mental. So my last video, I think, maybe the one before it, where I probably looked a bit pasty and a bit pale, I just had surgery, was when I got back to the hotel, and I was just really, really shocked that it was all done. I felt uncomfortable, but not really pain. The discomfort, the main discomfort, was the feeling of kind of bloated wind in my tummy. Like I really felt like I needed to just do the most immense burp, but it wasn't coming out. And that was kind of like, if you've ever had a really bad windy tummy, it can be quite uncomfortable, and you kind of get a stitch, you know, like stitch kind of pain. You're like, oh, it's a bit uncomfortable. Went back to the hotel, had a little drink of water, lay down, had a snooze. All was good.